It's connecting. There we are. I can see you. Can you see me?
I can see you.
It's connecting. It's connecting now. So let me just see that it's live on. Hi, everybody. It's Dr. Linda of the Vascular Birthmarks Foundation. I hope you can see me and hear me. I see I'm a little out of sync with my speaking. I'm looking right now on my phone to see that it pops up so I can see myself and our guests this week. I don't see it yet showing live, but let me just give it a minute to synchronize. It should be here before I introduce our guest. I'm not seeing it yet. Hold on. Let me go back. Vascular Birthmarks Foundation. Let me see the two of us. I should be seeing us on my phone, and I am not seeing us. Anyone seeing us? Oh, yep, I see 6 people are on. I just don't see it yet on my phone where I'll see the questions. So, well, I guess I will check back. Anyways, welcome everybody to the June 2022 VBF Facebook Live. As you can see, I have a guest, and behind her it says Boston Children's Hospital. And today's guest is Dr. Anna Pinto, Sturge-Weber syndrome expert from Boston Children's Hospital. She's a pediatric neurologist and also an expert in the keto diet, which has been used recently and with a lot of enthusiasm and research for the management of children with seizure disorder. I'm still looking on my phone. I see 9 of you are on. Can you comment if you see us and say that you see us? Because I'm not seeing any of the questions. I'm not seeing any comments. So in the comment section, can some of you just type hello, hi to us so we know? It shows 7 people are on, but I don't see the questions. Okay, so I'm still not seeing this show up on, it says we're live, but I don't see it on the Facebook Foundation, our VB. Oh, there we are. I do see it. And here are the comments. Tara Nesbitt is on and 5 other people. Great, this is great. So welcome, Dr. Pinto, and thank you for joining me. And I hope you've been having a good summer so far.
Yes, it has been a great summer.
And Gina is our marketing and communications manager. She can see us, and so can Ram Malka. And I'm seeing these come in on my cell phone here. So everybody, we have 9 people on. Dr. Pinto is here with me until 6 p.m. She will be happy to answer your questions concerning Sturge-Weber and when you have a port wine stain on the face, when you should be concerned. And we haven't gotten any questions yet, but I want to show you all that we do have 2 booklets on our website. One is the Sturge-Weber booklet and one is the port wine stain booklet. If you go to our website at birthmark.org, you will see these amazing booklets filled with facts. Yeah. The Sturge-Weber booklet was done by myself and Dr. Ann Comey, and it is the most frequently asked questions on Sturge-Weber. The port wine stain book was done by myself with Dr. Nelson and Dr. Geronimus. These are free PDFs on our website at birthmark.org. Just click on the picture of the Sturge-Weber or the port wine. You can see these. Tells you about testing you may need to be done, when to be concerned, and a lot of really important facts. So I see Julia Bubliak is on. Hi, Julia. Hi, Ram, Gina. Heather is on. We are ready to take your questions. I was just telling Dr. Pinto that I just came back from the ISFA, which is the International Society for the Study of Vascular Anomalies meeting in Vancouver last month. And they're talking a lot about keto diet for patients with vascular malformations, specifically patients with seizure disorder. And you know about that because you're the director of the Boston Children's Keto Program, correct?
That's correct. Even though our ketogenic diet program is dedicated, our mission is to treat patients with a seizure disorder. But of course, we have discovered more and more because of the properties of the ketogenic diet, including the anti-inflammatory property, and sometimes other aspects of the diet can be used for other disease. So more and more people are discovering some benefits. Even though I have to say for the epilepsy is a medically guided diet, is a restricted diet. It has side effects. So what I would say is that don't try this diet without a very good medical assessment, right? Because the diet has side effects. It's very important to make sure the diet is restricted, meaning that there are some vitamins that is lacking and minerals. So it's very important to make sure that whoever wants to be on the diet for medical reasons get a very good medical assessment for, contraindications, comorbidities, meaning like other, side effects, like I said, that can be associated. For example, one of the side effects is kidney stones. So we just want to make sure we get a very good medical assessment and guidance for this diet. However, Linda, what I have to say is that for epilepsy, you use this very restricted diet. Although I don't know for the angiogenesis or for other purpose, if that needs to be so restrictive. So I think for research would tell us what would be the degree of ketosis you want to achieve in order to have the results you want. So it's possible that patients that come to an assessment, not necessarily here because we only do epilepsy. However, once we have advanced on the research, it's possible that we will discover that the diet can be actually done in patients safely without major restrictions as we do for epilepsy. It's a different goal, right?
Great, thank you. So we have some questions coming in, two moms, I believe. And we got this question too a lot. We actually did a study. They both want to know, have you noticed any side effects with Port Wine or Sturge Weber patients who've had the COVID vaccine?
Oh yeah, so we have advised everybody to receive the vaccine because of course it's very important for overall the situation. We have here in our clinic, I had 2 patients who actually had seizure breakthrough during the time they received the vaccine, and I had a young child who the mother really wanted to vaccinate, and because the baby, not the baby, it was a young child, had low threshold for seizures because of illness, we decided to cover, the vaccine time with clonazepam. So what happened is that there is a way, if you notice any side effects, particularly seizures, in the settings of COVID vaccine, and you want to prevent the seizure exacerbation that could be associated with the vaccine, there is a way to treat that. I think it's very important to know that because the vaccine is very important. We all came to the conclusion that for neurological disease, to have the disease that the vaccine protects you is worse than they have the vaccine. I think it's a very important message.
Right, especially because it's a high fever disease, right?
Yes, exactly.
And high fevers can exacerbate seizures.
Exactly. And another point too, I don't know if people are aware, but COVID had a lot of stroke, right? So patients with, particularly the first variant, a lot of hypercoagulability state, meaning people with tendencies for clots. So of course, if you already have a vascular disease, you don't want your vessels to get clotted or have more thrombotic events. And this is one of the things seen with the COVID infection.
In our COVID study, we were mainly looking at changes in the birthmark. So we had patients that the birthmark got darker, but that was because they were missing their treatments because all the COVID shut down all vascular anomalies treatments that weren't like life-threatening. But our moms of the children with Sturge Weber, did not notice an increase in any seizure activity, but the babies were home, they weren't out, they weren't around other kids, they weren't getting as sick, they weren't having as many flus, cold, or viruses. So it's very hard to make a correlation. Absolutely. When there's so many variables.
Yeah. And even those patients who had with the first vaccine seizure around the time were not convinced that they were actually triggered by the vaccination. Even the moms wanted to continue to give the following vaccinations, and we just had to kind of work around, like I said, you know, by treating with a short-term benzodiazepine. So if your child has very frequent seizures and you have concerns about illness that can trigger the seizures or even the vaccine, talk to your provider, because you can do an intermittent treatment with something called a clonazepam or benzodiazepine. Is a possibility.
So that's very important for everybody to make a note, and you can go back and re-listen to this. So we have some other questions coming in for you. Michelle wants to know, when you say the diet doesn't have to be that restrictive, what do you mean?
So what I meant is that when the patient comes to an assessment for the ketogenic diet for epilepsy, the only way the diet works if you have consistent change on the metabolism in which the body produces something called the ketone bodies. So if all the time you break the diet, because the diet's high fat, well-balanced protein, but all the time you break by giving more carbohydrates, your body will shift the metabolism. That means you're going to have less ketone bodies. But if you're using that diet with the goal of treating seizures, if you don't keep that sustained ketosis, you can have seizure exacerbation, because it's the same as missing dose of your medication. However, if you are having the diet for other reasons, so meaning that you don't have to have that restricted, you know, levels of ketosis because you're not measuring seizures, you have for other reasons, it's possible that the diet can be more flexible. That's my point.
So it's almost like the keto diet is a boost for the anti-seizure meds. And so if you don't do it right, you can actually be modulating the effectiveness of the seizure med.
Seizures, yes. Is that nobody knows for sure how the ketogenic diet works for seizure. There are several mechanisms, several explanations. And what we believe is that every patient may benefit from one or more mechanisms. It so happened that we don't use that much for Sturge Weber. We're just talking about that, Linda and I. There was a time ago, Dr. Comey had a study about modified Atkins, which is a keto diet. In patients with Sturge Weber. It so happened that patients with Sturge Weber, they cannot be dehydrated. And sometimes the diet and the changes in metabolism can make you more vulnerable for dehydration. And that's why we don't use that much for patients with Sturge Weber.
Right. And I think I mentioned to you, you know, my master's degree was in nutrition. And so people who are on high ketogenic type diets, what happens is they secrete a lot of fluid from their body, which puts them into a state of dehydration, which can then trigger the seizures. So they really, really need to either stay hydrated or keep really close eye on this. It's a real balancing act, I guess, is what I'm saying, a real balancing. So Paige Young has a great question. She said she's reading a lot of different numbers online, 30, 40%, but she wants to know, with the patients that have the port wine on the eyelid area, what % do you think are at risk for Sturge Weber?
I agree with you, Linda. Wonderful, excellent question. Because what happened is that we have discovered from research that not only the location, but the size of the port wine matters. So, for example, when we see a patient with a port wine, particularly from neurology perspective, we try to be very descriptive of the area and the extension. So, for example, 75% of the forehead, 100% of the upper eyelid, something like that. So it's important to have a more specific, if one side or two sides. So depends on the extension and the location, it can go up to 40%. So the numbers matching up. Of course, depends on the location, and the extension could be 25%. So what you're hearing, unfortunately, the numbers is an estimation. We only consider what is to be a high-risk babies, and then we try to act on those high-risk babies. As everything in medicine, medicine is an art, right? So we cannot fixate so much in numbers, because the patients don't necessarily fall into that number category. You have to look every patient like, I mean, of course, number is very important to say, but you don't have to fixate on that. I think that's my message,
Right, and I know Dr. Comey has also been recently talking about not just the location, you briefly mentioned it, but the intensity of the stain or the density of the stain. That main location, that neurolocation, I guess we call it, because we don't want to say V1, V2, V3, that neurosusceptible location in the eye, the forehead area, by the temple, and pale pink versus deep intense red. The deep intense red in that is actually the highest risk.
The highest one. You're absolutely
right.
Yeah.
Okay, great. So another question from Joe Lewis is, are clots associated with vaccines?
Not that I am aware. I know, for example, for the amount of patients that have been vaccinated and the ones who had actually some complications with clotting, I don't think that would be a concern. It's just the disease has more clotting. The disease itself, with the infection from the virus. I am not aware of a number that would be associated with the vaccine, and I have not heard anything that could be a medically concerned. And as a matter of fact, I know from patients who have tendencies for clotting that continue to be receiving the vaccine. So they're exactly the ones who should get the vaccine, because they don't want to get the disease. They can get worsening clotting.
Right. So Amy Parcham has a great question, 2 parts, but it's great. Her 8-year-old son has been on the 4-to-1 ketogenic diet since 2017, so for 5 years.
Yes, wow.
He has been stable, seizure-free for 1 year. His neurologist and second opinion neurologist both seem reluctant to change or decrease his seizure meds. At what point do I push for a decrease? He is on multiple anti-epileptics, Topamax, Lamictal, clonazepam, Briviact, Neurotin, most maxed out.
Most maxed out. So I agree. Excellent question. So one, and I don't know if she can type. Is this patient with the Sturge-Weber syndrome? Because
yes.
Oh, maybe bilateral Sturge-Weber.
Well,
guess.
I mean, I think so, but that's a good point. By the way, Gina is on, and we can share with you Dr. Pinto's email for you to continue a conversation with her, especially because you mentioned, Amy, 1, 2, 3, 4, 5, 6 anti-seizure meds, plus he's on the diet. Now, the good news is she said he's been stable for 1 year.
So typically, I mean, I don't know if the patient has a Sturge-Weber or if it's some other form of epilepsy that it needs that amount of medication plus a diet. But one of the reasons people go to the diet is exactly to decrease the medication burden. So if patients take multiple medications and they have side effects, the diet can be one of the medications that allow the others to come off. So if he is stable for 1 year, and of course I don't want to, because I don't know the case in detail. So of course I have to respect the doctors who follow this patient for so long and know the patient well to be more reluctant to stop any sort of medication. But this is one of the reasons, if this boy is in multiple medications plus a diet, it would be time, to consider one of the medications to come off. Particularly the one that the parents, I can tell you from my practice, if I get the patient very stable and I want at some point to simplify this medication list, I often ask the parents what is the medication they feel that least contributed for seizure control, because and then we can always get the parents, understanding of their own kids, right? And then we can try to at least that one to come off and see what happens. Sometimes, for example, Topamax and the diet, I kind of don't like the combination together. So if somebody's taking topiramate which is the Topamax. I always try to take that one first, only because can we make it worse? The acidosis can make it worse, some of the side effects. But again,
Right.
I'm just saying in general, but every case needs to be, evaluated.
Right, evaluate individually. So we have a lot of questions coming in. So Paige Young said, her 6-month-old daughter has a high-risk birthmark in the orbit area. Do I need an MRI without contrast and then an MRI with contrast at age 1? We are interested in pursuing pre-symptomatic treatment, which I'm all for, but our neuro wants to just wait and see if she seizes.
Yes. So that comment, let's wait until she have the seizure, that was in 100 years ago when the disease was described, that would be, people would do that. I think what Dr. Kumi and I and other colleagues have tried to do is to create some neuroprotective strategies. So to answer, the quickly answer to your question would be, the first MRI, it's okay to be without contrast, because the first MRI, we are going after secondary features from the vascular malformation. So what means is that I don't care much if we don't see the vessels, because the vessels are very important with the contrast. At some point, every patient needs a study with the contrast, but the first one, we only want to see other features. So that's okay to have the first one without the contrast. And then what I have done in my clinic is not wait for the age of 1. Usually I wait for the age of 2. So we have discovered some patients with some variants that first year can be very unequivocal, like meaning very subtle changes. And some radiologists have missed some features. So I always like to wait it until the age of 2. So for your child, Pam, if you really want to pursue, I would do the pre-symptomatic study without the contrast, wait and then follow clinically if nothing else is there, and then repeat the study with the full protocol and contrast around the age of 2. That would be what I would recommend here.
Great. So Michelle Van Dyel said, if her daughter goes on the keto, can she go off her medicine? She's been seizure-free for 1 year and is on 2 anti-seizure meds.
So that varies. Some patients, sometimes they can come off anti-seizure medication. Sometimes the diet alone is not the, so keep in mind that the diet is an alternative treatment to the seizure. Some patients can be on the diet alone, and I've seen that, seizure-free on the diet alone. Very often they need at least another medication to support the seizure control. So every case is different. You can discuss with your provider. If the EEG normalized completely, you can stay on the diet alone, but if it's not fully normalized, sometimes you choose the medication you want to keep on along with the diet. That's the most common scenario.
Okay, thank you. So Amy is saying that the video froze. I don't know if it's freezing up for everybody. I'm not seeing it freeze on my end. Usually I do, but she wants to know, she said, I was able to hear you speak about Topamax being your first choice many times due to diet interaction. Is that true?
Yes. So for example, the Topamax, I would say the first one to come off, right? So for example, if I have somebody, if the Topamax or topiramate, I should say just the generic name, the topiramate is not contributing that much for the seizure control, and if the patient's on the diet, if you come to the conclusion that this medication can come off, I would favor that one to come off first. I think that's the message.
Okay. So Susie has a Quattro's question is, my 6-month-old baby had a Sturge-Weber syndrome diagnosis, medicated with Keppra. First seizure was 1 month ago, so at 5 months, and second med added, topiramate. Her Sturge-Weber syndrome is bilateral, and also she has the birthmark on a jaw, very dark, light on the eye, and neuro area. Is there anything extra medicine-wise that you would recommend for seizure management? Can I expect the seizures to now be regular, given that my daughter has had breakthrough seizures?
Yeah. So again, I have to speak in general. So in general,
Right.
Bilateral Sturge-Weber syndrome, they are highly associated with seizures. The first 2 years of life, the babies have tendencies for breakthrough while they are ill. so febrile illness is a very important trigger. So what we have recommended to the families are to keep the babies healthy, right, as much as they can, right? Be very aggressive to treat the febrile illness. So if they get fever, make sure to take the pediatrician to treat the fevers, because that's the scenario that they can have seizures. Keep in mind that they receive vaccinations. They need to receive their vaccine during the 2 years of life. But again, because sometimes what we have recommended is the month that they have several vaccines to be taken at once, to talk to the pediatrician to spread a little bit. Take one week, another one, just to keep the calendar, but just be more gentle distributing is one possibility. Another thing to aspirin. So every bilateral case can benefit from the use of aspirin. So aspirin would be another thing to consider. So yeah, so I think that would be my general answer to your questions. And usually we watch very closely our bilateral cases. One thing very important to mention, even bilateral cases, if they have a seizure coming from one specific areas, they still can be surgical candidates. We have here one baby who had bilateral Sturge Weber since the beginning, but her seizure focus were very located in one area. That area was removed, and she's now 3 years old, seizure free. And of course, she continues with seizure medication because she has other areas with potential for seizures. So make sure you discuss with your provider all the options, because it's very important to follow very closely. Some bilateral cases may not be a surgical candidate, others may be.
Yeah, and I've been following a lot of moms of the babies that have had the surgeries, and one of my favorite babies, baby Charlotte, she's progressing so well after having the surgery. I'm just so happy to hear that there are more options, because 20, 30 seizures a week or 10 a day is just unsustainable for some of these families. Oh, and Joe asked, so Joe, every one of our videos are recorded. They stay on our website, on our YouTube channel at birthmark.org forever. So you can go back and re-listen to this anytime you want. There won't be any breaks in it. It should have all the recordings. That's one of the good things. We go back and there's no blips when it's recording. So you can go back and listen again to what Dr. Pinto has said. Michelle wants to know, her daughter is 2 years old. Is she too young to start the keto diet?
No, it is not too young. Exactly the opposite. The ketogenic diet is not a very palatable diet for people that develop, taste for food. So the babies and the kids are more likely to be, if they are good candidates. And that's why it's so important, the medical assessment. Don't try to do anything on your own. We know not only can be very dangerous, you can make the baby sick if you try to do on your own. But what I would recommend, if you think that could be an option for your child, bring to your neurologist, discuss the case, go through a medical assessment, and 2 years old is not very young. Exactly the opposite. Sometimes we use a lot of the diet for infantile spasms, which is a form of epilepsy during infancy, and the babies actually respond really well to the diet. So babies can be on the diet.
Okay, thank you.
But again, medically guided. I wanted to emphasize this so
right,
badly.
medically guided.
Yeah, don't try anything on your own. It's
right.
Yeah.
And like you say too, everybody's body chemistry is different. Some people run low glycemic naturally, or low sodium, or their kidneys, they have some genetic family kidney issue. And so you always have to really have a good workup and speak to your doctor before you do this, because you don't want to make things worse.
Exactly. There are some absolute contraindications, and there are some relative contraindications. So, for example, high cholesterol is one of the things that can happen. So we need to investigate. You're absolutely right, Linda. You don't want to make things worse.
So, Susie, I believe we have provided in the discussion Dr. Pinto's email, and you can also get you are doing virtual consults, right, Dr.
Yes. That was one of the things that started during pandemic. We're capable to offer some, and I have seen patients, for second opinions. So we have online second opinions. We have virtual consultations. We can do that. Yes, absolutely. Yeah.
So because Susie's saying, how can I get tests to identify where the seizures are originating lateral cases, the consultant said no to surgery, but how can I ask for more investigation?
So again, it's possible that the doctor said no to surgery because they already discovered that the seizures are coming from everywhere, which kind of make it very difficult. Sometimes when you do the MRI and you notice all the areas affected are symmetrically affected, meaning like they are the same degree of effect from the Sturge Weber. So when you see that, sometimes we not get very encouraged to think about seizures. So the MRI, PET scan, EEG, all of them combined. And then usually every patient, in consideration for surgical approach, they need to go to a consensus. So what happens is that the patients get all the pre-surgical evaluation. We always present to a group of doctors. Absolutely no doctor alone would indicate a surgery. It's always a group of consensus that come to the conclusion that the surgical is a good approach. So you know.
Right, because it's a truly multidisciplinary disease that takes a consensus from neurology, hematology, pediatric, surgery, etc.
Exactly.
So Claudia has a question. Her son Aurelius is 2.5. He has not yet been diagnosed with Sturge-Weber syndrome, but he has the port wine on the left side of his face and his left leg with a 2.5 centimeter length overgrowth. He has also had heterochromia and has astigmatism and is short-sighted of his left eye. It's a darker eye. Is he a high risk for glaucoma? I feel in Australia, they only diagnose Sturge-Weber syndrome with port wine and brain involvement and not with the orbit. But I think that's an important thing for you to talk about. It's not just glaucoma that can make it Sturge-Weber.
Yeah, you're absolutely right. Glaucoma is the most common associated ocular manifestation, but other things too, including retina detachment, right? We have other, absolutely, yeah. So she's from Australia? Oh my God, we're getting people from Australia connected to us. Wonderful.
Oh, they check in from all over the world.
Yeah, that's so good. And of course in the Children's Hospital in Westmead in Sydney, they have a wonderful group of neurocutaneous and one of the doctors that graduated here at Boston Children's is there. She published, by the way, a beautiful paper in Sturge-Weber. They have a good group over there. So I think I think the way to pronounce this Children's Hospital Westmead in Sydney.
Okay, in Sydney, all right. So Lauren Sheehan has a question. Hi, Lauren. She wants to know, would you recommend a keto diet for an elementary age student with Sturge-Weber syndrome that has not had a seizure?
Oh, no, because of course, like I said, the diet, particularly with a patient with Sturge-Weber, the diet itself can result in side effects. Sometimes the diet can even have more side effects to some medication, for example, Capra. If you compare Capra to the diet has way more side effects, so so if the patient has no good reason to be on the diet, I would not recommend. It needs to be followed very closely. In a school age children, they like, for example, if he goes into the diet for medical reasons, they cannot eat like cakes and candies and things. So I would, it is not so, like I say, palatable for patients when they are already kind of like to eat and they have their food preference. I would not, if there is no clinical symptom for you to go after, I would say no. However, what Linda was saying at the beginning is that once we decide for a more research on proliferative vascular lesions, then the diet can be potentially offered, but not for the port wine, just not for, I would not do that, no.
So Claudia has a really good makes a really good statement, and this comes up a lot. So her son's or her child's brain MRI at a few months of age was clear, but that doesn't mean they're out of the woods, correct?
Correct. So unfortunately, I mean, if you have an MRI done at the age of 1 with all full protocol in the very good center, there's a very good chance you would be cleared. However, we have encountered patients who had that. Unfortunately, small lesions were actually missed because we're so early in the game. And that's why, for example, in our center, I try to convince the parents to wait at least until 2 years. I'm just going to step back a little bit and make a statement. The best age for neurology to image a brain in general is the age of 2. Why is that? Because there is a completion of the most important developmental steps. Okay, and the last one is called the white matter creation, right? So we have all the very mature elements. So the best way for you to get, a very good image in any baby's brain is around the age of 2, at least, right? And then after that, just get mature. So anything before, you encounter the possibility to find some dismature things, maybe little things here and there that could be overlooked, because, maybe it's just dismature and is actually pathological. And that's why I prefer to wait until the age of 2. And then I understand other centers do that. Depends a lot of parental anxiety, of getting the MRI done so they can feel less anxious about the expectations of brain association. But and that's why we need to work close with the family to say, look, we're here, let's wait, because otherwise you may not, get all the best results. This is what I try to do in my clinic, at least.
All right, thank you. Well, we're having a very busy session. We have 25 minutes left. It's been very packed. Michelle says she's discussed a keto diet with her child's neurologist. They told her it was a last resort. They are very reluctant. They say they only do keto if the seizure are refractory.
Yeah, so bottom line is that, like I will repeat, the ketogenic diet has side effects, and that is considered to be an alternative treatment. It has been on a medical scenario for at least 100 years. So we know the ketogenic diet is an old, approach to seizures. And I have to say every case is a case. I have patients here that it depends on the epilepsy cause. If there is a Sturge Weber, I would still prefer medication. I agree with the doctor. But if it's not a Sturge Weber, depends on the type of seizures, the type of epilepsy, the type of diagnosis. The diet, they don't have to wait and don't have to be the last resource. Again, I don't know the details and of course I have to trust what your provider said to you. But I just wanted to let you know that in some cases, it doesn't have to be the last resource. But Sturge Weber, I would say I would still prefer medication.
Thank you. It's also good for some of you to tell us where you are, just in case Dr. Pinto has a colleague in your country.
Oh, yeah.
The next question is from Bashar. So his daughter has Sturge Weber syndrome. She is 2 years old. After a brain operation, she is seizure-free for more than a year. What is the probability of her seizures returning, and what do you advise to follow up on her condition in the future? Also, after the operation, she had weakness on the right side of her body, but she started to improve and walk, but the hand cannot move completely yet.
Yes. I suspect that the surgery and then of course she can put on the comment, if it was a hemispherectomy with the disconnection of the entire hemisphere. So it so happened that actually Dr. Komi and I, we made a revision about the medications and long-term, use of medication. And in our conclusion, a surgical procedure was the single approach that can make somebody seizure-free and medication-free. If you still have the lesion, even if you don't have seizures for 10 years or 20 years, you even become an adult, you still have the chance to have a seizure if you stop anti-seizure medication, unless you had a surgical procedure, particularly hemispherectomy. So there is a very good chance your child won't have seizures anymore. And I think it was a she, right? Is a girl, yeah. And she will be able to come off medication, and then of course the weakness from the surgical procedure can be more dense in comparison to the hemiparesis, which is a deficit caused by the disease. Although you notice that weakness in the visual field cut, those things being more pronounced with the surgery, sometimes the benefits is way more. We know that. Yeah.
Yep. So Susie just wants us to know she's on, and she's in the UK. And I want to mention December 9th or 10th, we will be posting this by July 1st. Dr. Pinto will be with me in Milan for our free laser, ultrasound, and Sturge Weber syndrome consultation clinic. That'll be in Milan on either Friday, December 9th or Saturday, December 10th, and it will be free. So we will be offering a free ultrasound, free laser, and free Sturge Weber consultation. Look at our website at birthmark.org and follow us on Facebook when the registration opens on July 1st. Paige wants to know, is it typical to find high eye pressure first and then brain involvement, or is it possible to have brain involvement and no eye issues?
Yeah, that's an excellent question. And you're absolutely right, all the possibilities. I have patients who had glaucoma, so it'll increase ocular pressure with no seizures, no brain involvement either. We have patients with seizures and the eyes remain in a very good, pressure levels. The possibilities are, when you have bilateral brain involvement, the ocular complications almost 100%. So we know that the ocular or the glaucoma is going to be there at some point in time. What is very important for patients to keep that recommendation is that the ocular manifestation is a lifetime risk. Even if the patient, is the first infancy, doesn't show anything, adolescent, nothing, in adulthood, had to continue to monitor the ocular pressure. It's a lifetime risk. It's very important to know.
So we have a shout out to you from great admiring patients. So Dr. Sean Leichty, his wife Mara, and Ellen and Hillary say they love you. And
oh my God, I love this family. Yay!
I do too. He was one of our parent advocates and a doctor that spoke on our day before Capitol Hill for lobbying our legislation to mandate the insurance companies cover all treatment. So
oh my God,
I'm very excited to see that they
wonderful family, wonderful family. I'm so glad they're here.
Yes. So we have 16 minutes left. We can take more questions. Once again, we have our Sturge-Weber syndrome and our port wine stain booklets, frequently asked questions, on our website. You go to birthmark.org, you click on it, and you click on the picture, either port wine or Sturge-Weber, it'll immediately pop up. Also, as I just mentioned, 2 times you can see Dr. Pinto for free. She will be with us on October 8th in California at our big VBF super clinic. Dr. Comey will be there, Dr. Pinto, Dr. Nelson, all of our doctors will be there, so you can get a free laser, free consultation, free dental if you have gum and dental involvement, psychotherapy sessions, free ultrasound. So that's the weekend of October 8th, Saturday, October 8th. And then she'll be with me 2 months later on December 9th or 10th in Milan. So she'll be there for free Sturge-Weber consultations. How often should eye pressure be checked with bilateral Sturge-Weber syndrome?
Yeah, so there is an ongoing discussion about to establish some protocols and guidelines. So the first 2 years of life should be at least 3 to 4 month interval. So they'll be more closely checked. After that, 6 month interval is fine. When the patients got very close to puberty, they should be rechecked again, like more often, because again, the second peak for ocular manifestations is during a transition to adolescence. And then once the patient goes through all those phases, nothing happens. Of course, we can always check once a year, but our colleagues from ophthalmology, they always say that it's not uncommon that they get the cases already late, because there is no symptom. The only way to see if the pressure is elevated, causing any sort of damage to the vision, is by measuring the pressure, because the patient won't tell that they are having symptoms. So the recommendation would be for bilateral patients, I would say 3 to 4 months. I would, stick on that.
And also, I think it's very important. A lot of people just go into the, ophthalmologist's office and get a simple pressure check. But we often sometimes recommend that they, sometimes the babies actually have to go under anesthesia for a more thorough check, because there's signs like the baby will, what we call pinch the eye, the port wine eye, whenever it's out in the light, but the doctor will say, oh, there's no glaucoma, but you can clearly see the eye is always pinching. Yeah. And Dr. Comey and I talked about that as an early indicator for Sturge Weber. And then when that's the case, if you see the baby's eye pinch in the light where the stain is, you should really get a more thorough exam because it can be an early alert.
Absolutely, including the increase of the scleral vessels, like the white part of the eye. You see a little bit more vasculature over there, so that would be another indication too.
So Bashir wants you to know that his child had the hemispherectomy, and he wants you to know that they are on tonight from Saudi Arabia. So again, like, you know, we manage or post on over 70 groups on Facebook, and these represent a total of 80,000 patients worldwide with various forms of what we call VBARs, so vascular birthmarks, anomalies, and related syndromes. And whenever we go live, we post to all those relevant groups so that the families from all around the world can have the same equal access to accurate information, which is very important to our mission, which is everyone, no matter where you're from, gets the accurate and most current information on diagnosis and treatment for Sturge Weber, port wine, hemangioma, any of our VBARs. And we are very proud that we offer this monthly service, and our fact books, our fact sheets, or I'm working on one right now for lymphatic malformations that'll be 2022 current with the latest drug therapies. So always check at birthmark.org, click on the circle that shows one of the 9 birthmark types, and you will find the most current information, any research that's currently being on and done. Oh, and I would like to ask myself, is Boston Children's working, and yourself working with any of the cannabidiol studies, or are you using the cannabidiol?
So I have to say that I will be involved in studies with that. The answer is yes, I will be. I will be, but I'm not recruiting anybody for now. And yeah, in the process of organizing, you know, yes.
So we have a young man who's been involved with VBF for 15 years. His mother is on our board, and so is his grandmother. He's 26. And was treating himself with marijuana, and he's been seizure free for 6 years for the first time in his life. I'm not recommending that, but I'm just saying it does say there's something there for us to look at.
Absolutely, absolutely. And actually, Dr. Comey had the only study published on the CBD and Sturge Weber came from her group. But I think soon we'll have more and more evidences and work together. And it's a pleasure working with her. I think we join our forces and our desire to have the best answers for our patients. So we have very fortunate to be able to work together.
Yeah, I'm always excited to see the two of you in our room at our clinic, because it's like we've got the two top, one from Boston Children's and one from Hopkins, and we're just very proud that we have your expertise. So Susie wants to know, her daughter's port wine stain, in addition to being in the Sturge Weber area, it's also on her earlobe, and she wants to know if she can get her earlobes pierced.
Oh, so cute. Yeah. So that would be so, for example, I of course we need to take a look and see. I would love to imagine, like, our dermatologist would take a good look, because of course it is an area that is more increased vessels, right? So we know that if you, even though the punch, like just to do the piercing is not so pronounced, so I mean, it's possible that it would be safe, but I would definitely check with the dermatologist.
Yeah, and they can go to our birthmark.org and ask Dr. Nelson or Dr. Geronimus. They deal with this all the time. Yeah. Sometimes Dr. Nelson, when he has a baby under GA for a laser, will actually pierce the ears, or the parents will ask him, will you put the earrings in? And
exactly, good opportunity. Yes, exactly. Yeah. And in particular, because they will know exactly what the area, because the punch itself is very little, but of course depends on the degree of the port wine and the vascular. But yes,
right, right. So we have 11 minutes left, and it's been very active. Again, to all of you moms and dads and adults with Sturge Weber that are on. You can go back and re-listen to this. You can go back and re-listen to any of Dr. Comey's Sturge Weber Zoom sessions that I've been doing with her since 2017. I'm thrilled that this is our first time with Dr. Pinto, and I'm thrilled that we will have her back again, and we'll have her in California in October and Milan in December. I'd like to know, in addition to you moving closer to the cannabis study and the keto diet, is there anything else going on that you're working on that can give hope to our families? Is there anything for more preventative for the glaucoma or the seizures that anyone's looking at?
Yeah, so we are working collaboration to look into biomarkers. So there are at least two aspects of Sturge Weber. One, to identify the high-risk babies, and another one is to try to find biomarkers that could tell us which direction this epilepsy is going to take. It's going to be an epilepsy that will be well controlled with medication or needs like maybe surgical approach. So we are working into that. Dr. Comey and I were looking into the urine biomarkers. So actually I'm part of that study with her. We have this whole aspect of diagnosis and prognosis marker, and then of course medication trials. And right now I'm not involved in any specific one. Another thing that I have been very closely involved with the animal models that we are working with our basic scientists. And as soon as we get more, we're hoping to test some medications on animal models so we can see how the vessels and overall the brain reacts to that. We have also working very closely to different cases associated with different gene type. We have encountered some patients with atypical Sturge Weber associated with different genetic profile, and this has been very fascinating because we have seen different outcomes. For example, patients without calcifications in the brain and the Sturge Weber associated with another type of genetic mutation. So this is a very, I would say, fast-pacing, evolution from since the gene was discovered that allow us to discover more in terms of diagnosis and prognosis and, of course, treatment.
So I also wanted to bring to your attention, and I know I've talked to Dr. Comey about this in the past. We've had a lot of mothers of boys and a lot of mothers of girls with Sturge Weber say the same thing, which makes me wonder of a pattern where they say the boys are like in the low percentile of growth, but the girls are in a high percentile of growth. So like the girls may be taller than both parents and the boys a lot shorter. Is there ever been anything to look at that?
Not yet. There was one study regarding to the growth hormone that, for example, we watch very closely, but it would be everybody. And so, for example, from an endocrinology perspective, central hypothyroidism has been watching very closely. This can influence growth. Of course, can be associated with medication too, so we kind of watch very closely for that. Growth hormones, we have seen patients that sometimes we even have some experts in endocrinology here at Boston Children's that we like to work together, so we watch closely for that. I have not seen that difference. I would love to pay attention. I'm very grateful that you brought this to my attention, so I will pay attention, boys versus girls. But I'm just going very quickly on my mind. I had a lot of girls who actually had to send, but for exactly the other reasons. They're not eating well, they're not growing well. So that was for different reasons. But I'll be more attentive to your comments. Thank you, Linda.
Yeah, I mean, that's something we can also do surveys for you if you want on SurveyMonkey, is ask what percentile growth is your child measuring, and just look at them. Are they measuring? We don't have to ask height, just are they following 50 percentile, 25, or off the chart? It'd be interesting. We have another question from a mom, where if the baby is at high risk, at what age do most seizures start, or is it too variable to say?
Yeah, excellent question. So for example, the patients with high risk, seizures, there is a window. So we never see patients having seizures before the age of 30 days. And that's why we don't encourage MRIs earlier than 6 weeks, even if the port wine is very extensive. So the baby needs to be at least 8 to 10 weeks old to get the first MRI done. Okay, that's a good point. Then what typically we see is the most common age of onset would be between the 4 and 6 months of age. So when you have high risk during that time, we see very often associated with illness, either with the fever, vomiting, or diarrhea, that kind of triggers. Others, they can come completely out of the blue if the babies are healthy. And then, of course, we have a lot of other variations. So, but it is a common age, and then you have everything else. Yes. I hope I answered your question.
No, that's excellent. And Susie wants to know, like, if there is any new research and that you're looking for, parents of children to participate in, how would she know about that? And I guess it would be on your website or shared through VBF, right?
Yeah. So actually, we just got, at this point in time, we're not recruiting anybody because we are in the process of getting our funds and grant applications and things like so. We're just pretty much on that process. So Dr. Komi and I, we typically publish our studies on the NIH, whenever we have the grant accepted in the page. But I think it's a wonderful idea, Linda. Next time if there is anything, as soon as we get our studies, ready to run, we're going to, of course, do through the Birthmark Foundation. I think it's going to be a wonderful way for you to help us recruit and make sure everybody knows about that.
So there's another important thing that I think is worth mentioning as we come to a close, which is one of the reasons possibly, you'll answer this, but I think I know the answer, that you don't really like to do the MRI before 6 weeks is these babies are very spastic, and it's kind of hard, they're very spastic under 6 weeks of age, and you may be seeing just a normal newborn spasticity, not really a seizure, and you really got to let them settle in so that if it's a seizure or if it's just a normal floppy baby or a spastic.
No, and very interesting, Linda, that you said very quickly. So the babies, exactly, they're born very because they're intrauterus, they have all, and then they start losing up a little bit their tone. You're absolutely right. Not to mention that they have something called clonus, which is kind of this, beats of their feet and their arms that people sometimes mistaken with seizures because they kind of stretch out and they have this clonus. So you're absolutely right about waiting. The main problem with the MRI before the age of 6 weeks is that very often they are false negatives. So when you run the MRI, the signs are not there yet. We just have to wait them a little bit more for them to become a little bit more obvious in order to at least provide some guidance about pre-symptomatic treatment. Yes.
Thank you. Another thing that we've often heard about, which I would really like you to address as we come to a close, which is some of the things parents can look for that they may not be aware of that may be the beginning of a seizure, where Dr. Comey talks about the fisting or the eye tracking. Can you talk a little bit about some things parents should do?
Something to keep in mind that usually the neurological symptom is contralateral to the port wine. So if the baby has a port wine on the right side, be more attentive to the left side of the body, since the right side control the left side. The most common scenario is exactly the clenched little hand. So they do like that. And then for seizure, they would have some close, and then they have this kind of movement. So if the baby has hands open and doing this, unlikely this is a seizure. The seizure would be clenched hand. And then one of the things, the first year of life, baby should not have hand preference. If the baby only use the right hand or only use the left hand, this is not normal. They need to be, because they are not right-handed or left-handed that early. So that would be a sign of importance. And another point is exactly this: if they seem to neglect one part of the peripheral vision, that would be another thing too. Yes.
Wow. So this has been an amazing session, Dr. Pinto. The families are thanking us and saying thank you to VBF. and to you that they get more information from these sessions than they do often, because they don't really have enough time to ask all these questions at their doctor's appointment. So I want to really thank you. I want to encourage all of you who are on to share the link to VBF to watch this, to any of the other Sturge Weber families that you're in communication with on Facebook, and also to go to our Facebook page, which is this page, Vascular Birthmarks Foundation. And you can see next month, I believe we will be having Dr. Roy Geronimus on to talk about the newest lasers that are out and new studies on treating port wine stains. Actually, I'm hoping to get them. We're in discussion for that now. So thank you very much, Dr. Comey, and stay healthy and stay well to everybody. And once again, check us out for the Super Clinic in October in Irvine, California, where you get free lodging, free consultation, free laser, everything I mentioned. And then follow us for the free clinic in Milan, Italy, for all of you in Europe or the Middle East who don't have access to this. So thank you all and take care.
Thank you, Linda.